You ask the question to the patient via the interpreter, right? So it's me saying to the interpreter here, okay, right, I need to know about how, I don't know, what can I say, how many stairs they have at home and, you know, if they're prepared to take them at home. So interpreter goes, jabba, 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 jabba. I'm thinking, I didn't really think I said all that. And then you type back, jabba, 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 jabba. This goes on and on and on. And then this person said, they have 4 stairs. Okay. And, well, that's not a good interpreter. Okay.
Yeah.
So interpreters are trained. And why I'm saying this is, the interpreter you need has to be a qualified person and not necessarily a family member. You know, you might find that the son or the daughter or a family member speaks very good English, yes, and will say, oh, I can interpret for you. But it's often they're asking the questions or putting a slant on the question that they want answered, not necessarily what their mother, grandmother, father, auntie,
And potentially
uncle want.
berating the patient as well.
Yeah, or saying, or, you know, so having a professional do it. I mean, I've often had family come in during treatment to help explain what I'm doing. That's a different situation, which is often good because that allows them to ask you questions, also allows them to then say to the patient, oh, look, you're doing really well, and, you know, reinforcing stuff if I want them to do some homework or exercises. But when you're trying to look at discharge planning and what people need when they go home and
Goal setting,
all of those
their
sorts of
understanding
things,
of their
you
problem.
need someone who's a very good interpreter. Who, I mean, I had an excellent interpreter who said to me, she turned to me, she says, you're asking too many questions. And I thought, oh, sorry. So, which was true, and that was good for me because it meant I was learning, you know, as well, how to ask the appropriate question that she would then, and then she would ask, and then she says, oh, the daughter wants to ask a question, is that all right? You know, so that was really, it engaged everybody around the table. It also meant that sometimes we didn't have to ask, well, I didn't have to ask questions because the OT was asking them, or the doctor was asking them, or the social worker was getting involved, or we could say that was happening. So interpreters are valuable people, not to be taken lightly, and can be expensive.
And are a requirement for, at least for the physiotherapy, for physiotherapists, the APP, the Australian Physiotherapy Process, can't think what that stands for, actually requires health professionals to use interpreters. So it is an expectation that you will. It's just not an expectation that you'll use the interpreter every time you see the patient. But you will need to. It needs to be something that you plan to do.
I think this is okay. This is okay to ask them if there are any family members to translate the language they are using first. And if you can't get enough information, then you can try thinking.
No, it's not that. You actually need it separately, an interpreter. Even if you have a family member, you need separate identification of that information directly from the patient.
Because you remember, you're documenting this, and the documentation is a legal record. So you will have written down, spoke to family member, blah blah blah, and someone will say, well, how do you know that that information is correct? So when you write down and document that, so if you have a big meeting with the interpreter there, then there's one person, usually it's the doctor who's writing it down if he's there. If it's not, it's usually the social worker or the clinical nurse specialist, or like stroke liaison nurse or something. The most appropriate person, but it could be anybody. And they're writing down, you know, meeting, like goal setting meeting, planning meeting, whatever meeting it is, with interpreter, and it will have the interpreter's name there. And then the following issues were discussed, goals, what was planned, and the results of the meeting. So everything is there. So that's, but just like I was saying, it doesn't mean you don't include the family in, but it's how you include the family, and also that you document that. So if I brought a family member in to observe treatment or something, I would say, you know, treatment today, daughter attended, reinforce this, given exercises, you know, all. So it would all be written down. That meant that if the speech pathologist came along and wanted to, she would see that, you know, we've already discussed this with the daughter, and that's fine. It could be that there was a chest problem, you know, they weren't clearing secretions or something like that. And then, you know, or might recommend that daughter speak to speech pathologists re-feeding, because we might have found out that family have been feeding the patient but giving them the wrong sort of stuff, and that's been making the chest worse, and I may have found that out at that meeting. So then, you know, we can sort of arrange something. Because family want to do the best, and they often feel, you know, I'll bring food in, I'll bring, you know, and culturally, a lot of people don't like a lot of Western food, you know. Aboriginal patients, they love it when they get, what is it, kangaroo and all the rest of it, bush tucker, because now hospitals have bush tucker for people from country. Oh yeah,
Only for people who need that.
who need it, like who have come from.
You can't have your gourmet treat going into hospital.
Okay.
Yeah. So it's to make, you know, hospital a better experience, because it's not. We don't want people loving hospitals too much, because we never discharge anybody.
Stay there forever.
But we don't want to make it a horrible experience, do we? No.